everyone, it's Margarita from drregisterednurse.com. Today is part 3 of test taking strategies with NCLEX questions. You won't want to miss it. Now that many of you are in the virtual learning setting due to the current COVID-19 pandemic, it is super important for you to maintain those test taking strategies when doing online quizzes, tests, exams, and for those of you that are going to be allowed to take the NCLEX, make sure that you are up to date with those strategies prior to taking the exam. Make sure to watch parts 1 and 2 in this YouTube channel, Dr. Registered Nurse, and practice some questions after you've combined both parts and this one to see how well you do. Let's get started. We're first going to start by reviewing parts of a question. Remember, when trying to improve your test-taking skills, it is very important to identify the various components of a multiple choice question. The STEM is the part that asks the question. There will also be case scenarios, which is a patient situation, and there are distractors, which are choices that are actually wrong or not the best answer. And if you know nursing tests, all of the answers usually sound right, may be right, but which one is the best answer? Now, you have to make sure that you are analyzing each question, that you are reading each question, and that you understand what the question is asking you. Let's quickly review parts 1 and 2, test-taking strategies, before we move on to doing different types of questions. So here we have part 1 and 2, but remember, go back and watch the full video so you can get all the information. This is a quick review. So first, I always say, cover your answers when you are faced with a multiple choice question. It could be selectively apply or any type of different question that you may get. Cover the answers because that allows you to have a blank slate as to what they're asking you, and you can critically think all the things that can affect this patient or that can happen for safety reasons regarding whatever it is that the question is asking. So cover the choices, think about what they're asking you, and then try to generate some choices yourself that might be the answer to the question. And guess what? When you look at those choices, 99% of the time, you've already answered the question. Second, make sure that you're reading that question. And remember, take 20 seconds to think about what the question is asking you. So 1, make sure you cover the choices, then read your question and take 20 seconds to really think, what is it that this question wants from me? What is it that they're trying to figure out? Is it a respiratory question? Is it a cardiac question? Is it a safety question? Remember, the boards, the NCLEX, are trying to determine how safe you are as a practicing nurse. And if you're taking these test-taking strategies for any other exam, it is the same thing. They're trying to make sure that you understand what is being asked of you before you actually answer the question. Part 2 talks about eliminating those absolute responses. For example, nothing is 100% right. What works for one patient or for one person doesn't work for another person. So you want to make sure that you eliminate all those absolutes that make something 100% legit, which have words that are dangerous. For example, all. They might ask you a question like this work for this population, and one of the choices can be it works for all populations, it works for some populations, it works for a few populations. So which one makes something 100% absolute is a dangerous word. So it's the word all or always. So make sure that you are looking for those dangerous words when you are trying to eliminate an answer choice. Next, make sure that you are looking at those umbrella answers. Those umbrella answer choices are inclusive of everything else. And if you look at our part 2 test-taking strategies video in this channel, I gave some examples. For example, we talked about the power of attorney and the live-in will. So when you are asked certain questions, look at to see, are all those other 3 choices inclusive of the 4th choice or whatever order it is? Those are called umbrella answers. Test-taking strategies part 3, number 7, 8, and 9. 7, if the question is missing an assessment component, then the answer is an assessment choice. You cannot do an intervention without doing all the assessment parts first, right? I cannot jump in to go see if a patient is actually coding and just press the code button in the room if I haven't assessed my patient. Because it could be a rapid response. It could be that the patient's blood sugar is low. So you never want to act before you have all of your data together. So always remember that. If you have a question that pertains to an assessment and the choices are assessments and interventions, ask yourself, do you have all of the assessment components in place? So if you do, of course, you're going to pick an intervention, which is the next test-taking strategy. But if you are missing an assessment component, it cannot be an intervention because you need to have all the things in place prior to doing an action. The same goes, and I just reviewed that. If you have all of your assessment components, then the answer will be an intervention. So if you have an assessment question and it tells you what should the nurse do next, and we're going to review some of those questions, then if everything has been completed, then the next step would be an intervention. So usually those questions will have 3 assessments and 1 intervention, and the intervention one will be the answer because you've already gathered all of the data you need in order to do an action. Also, make sure you're looking at any answers that are opposites. If they ask you a certain question about a patient and they have tachycardia or bradycardia in there, and then they have 2 other choices, more than likely it's going to be either the bradycardia or the tachycardia. So make sure that you're looking at those opposite responses. So to review it before we move on to doing questions, 1, if you don't have all of your assessment components in place, which means all of the data that you need in order to make an action, the response will be an assessment choice. If you have all your assessment components, everything you need to do an action, then the answer choice will be an intervention. And make sure that you're looking at those opposite responses because more than likely, one of them will be the answer choice. Now let's start doing questions. Remember again, read all instructions and test questions carefully when starting an exam, a quiz, or any type of test. Answer only what is being asked and stop reading into the question. I have many students that will create a storyline in their head when they are asked a particular question. For example, I'm going to just throw a question out here, simple thing. The patient needs to go to the bathroom. What should you do if they have a Foley catheter? This is the storyline that some of my students will put in their heads. Well, if they have a Foley catheter, how about if somebody's standing next to the bed or next to the chair, I'm going to have to move the chair, and then the chair is going to be in the way of the patient and going to the bathroom. The question didn't tell you any of that. You have to assume in NCLEX world, in these exams, that you have everything readily available and you have the space to do so unless otherwise noted. So if the question does not add all those additional details, you should not be adding it for them because that is not your job. Your job is to read the question, stop reading into the question, and just answer the question, knowing that everything is available to you. And make sure that you're timing yourself. Remember, I want you to take 20 seconds to read this question, and then I want you to think about it without looking at the choices. So make sure you're timing yourself because all of these exams, the NCLEX, HESI, ATI, all these things are timed. So you want to make sure that you're taking the appropriate amount of time for the question that you're being asked. So now let's start the questions. Question number 1. An adult male client had a total hip arthroplasty 2 days ago. Post-operative orders include narcotic every 3 to 4 hours as needed for pain. He was last medicated 3 hours ago. Which one of the following actions would it be most appropriate for the nurse to take initially? So take the time to read the question a second time for 20 seconds. Now, remember, in NCLEX world, you are one nurse with only one patient. Okay, remember, don't add to the storyline. All the other orders or all the orders you need are written. The only time the nurse would need to call the doctor is after an intervention has failed and there's nothing else the nurse can do. If you have to call the physician about concerns, never call about something that is expected with the disease process, which is why it is essential for nursing students to know expected signs and symptoms of the disease versus signs and symptoms of potential complications. So look at this question and start thinking about all of the strategies we've reviewed so far and what is it that they're asking you before I put the slide with the choices. So it's telling you that 2 days ago, this patient had a total hip arthroplasty. The orders include providing the patient every 3 to 4 hours pain medication and that is the interval. He was last medicated 3 hours ago. Which of the following actions would it be most appropriate for the nurse to take initially? So if you're thinking that there are things missing here, is there an assessment parts missing? Yes, because you know that when you're doing a pain assessment, not only do you need to know the orders, like if there are any narcotic orders, and they are here, there's every 3 to 4 hours the patient can get a narcotic for pain, but you have to do an assessment. You have to ask yourself, okay, did I give this medication? When was it last given? It tells you 3 hours ago. I am going to ask the patient, what is their pain level? Because when you are giving pain medication or narcotic to a patient, it's going to ask you to document the pain level that the patient states, 0 to 10. Where is it hurting? This doesn't tell you that the patient complains of pain at the hip. It just tells you that he had a surgery 2 days ago, a total hip arthroplasty. His head may hurt. Nothing doesn't mean that it necessarily hurts at the hip. So don't assume. So you need to know that information. So you need to know the pain level. You need to know the site. Does it radiate anywhere? What are the patient's vital signs? Because you know that if the patient's blood pressure and heart rate are not within normal limits and they are low, certain types of narcotics should not be given, for example, IV ones like dilaudid hydromorphone, because it will lower those vitals further. So there are several things that are missing in this question. So am I going to pick an intervention or am I going to pick an assessment? Let's show you the answer choices. So here you have the answer choices for our adult male client that had a total hip arthroplasty 2 days ago. So, number 1, administer the prescribed analgesic. Number 2, assess the location and nature of the pain. Number 3, reposition the patient. And number 4, refill the ice bag ordered for the knee. So looking at our question and us knowing that there are some assessments missing here, which one would it be? Would I go ahead and administer the prescribed analgesic? No, because I don't have enough information that will allow me to determine, do they actually need this narcotic? Or is it time for the narcotic? Does it hurt at the hip? Because remember, a lot of times these narcotics are attached to parameters. So you might get Tylenol or acetaminophen for a headache pain as opposed to the Percocet or the Dilaudid for the operative pain. So you cannot assume. So at this time, I would not administer the prescribed analgesic because I don't have enough information. 2, assess the location and nature of the pain. Well, do I have this information? Based on the question that's here, without assuming or adding any storylines, I do not have the location of the pain because I am not going to assume that the hip hurts because it could be it could be the back, it could be the head, it could be the ear. And I don't know the nature of the pain. Is it where it is or is it radiating anywhere? Is it chest pain, which will require other types of assessments? So let's keep number 2. 3, reposition the patient. So without an assessment or knowing what hurts with this patient, repositioning is not the best choice because if this patient had a total hip arthroplasty 2 days ago, positioning might not be what needs to be done because you don't know the amount of pain or what are those medical orders regarding ambulation or movement of the patient. And this is not going to give me more information that is missing in my question. 4, refill the ice bag ordered for the knee. What is this going to do? What do you do with ice? Usually you will put that when there is inflammation. That is not what the question is asking you. The question is asking you about pain assessment. So the only choice that is a valid, correct choice here would be 2, assess the location and nature of pain because you do not have that information in order for you to be able to do number 1, administer the prescribed analgesic. Now, let's go to question number 2. An adult male client had a total hip arthroplasty 2 days ago. Postoperative orders include narcotic every 3 to 4 hours as needed for pain. The client complains of pain that is a 10 out of 10 in the operative area. Vital signs are within normal limits. He was last medicated 3 hours ago. Which of the following actions would it be most appropriate for the nurse to take initially? So this is the same question as question 1, but what is the difference? That you have now more information. You not only know that you have a narcotic order for pain, you know the level of pain, you know that the vital signs are normal, you know where it hurts, and you know that he was last medicated 3 hours ago, which is within the time interval that the patient can get pain medicine. So here you have all those assessment components that you would need in order to do an intervention. So I put this question here so you could see the difference. And these are actual NCLEX questions. You will never get these questions because they've already gotten out of the system. But this is how you would determine an assessment or an intervention. And here, let's look at the answer choices. Number 1, administer the prescribed analgesic. Number 2, assess the location and nature of pain. Number 3, reposition the patient. And number 4, refill the ice bag ordered for the knee. So let's look at 1, administer the prescribed analgesic. So I ask myself, do I have enough information that will allow me to make an informed decision as to providing the patient this pain medicine? I have all the components needed for my pain assessment, so I'm going to keep this answer and I'm going to analyze the rest. Assess the location and nature of the pain. Do I have this information? I do. It says that it hurts in the operative area and that the patient's a 10 out of 10. Number 3, reposition the patient. Is this going to further harm the patient or cause more pain because it hurts at the operative site? Is this going to do an immediate response to the patient's complaint? No. And a lot of times when patients have had this type of surgery, they can only stay in a certain position according to the physician's orders or the surgeon's orders. Number 4, refill the ice bag ordered for the knee. This question does not refer to anything regarding inflammation, so I'm going to eliminate it. So right now I'm eliminating numbers 3 and 4. Number 2, I'm also eliminating because I already have the response about assessing the location and nature of the pain in the question. So the answer here, because I have all of my components, is to actually administer the prescribed analgesic. Let's move on to question number 3. The healthcare provider orders anti-embolism stockings for a patient postoperatively. When should the anti-embolism stockings be put on? So the person had surgery. We're in the post-operative environment. This is me analyzing the question for those 20 seconds. And then I'm thinking, when do patients get anti-embolism stockings put on? Well, they're put on when they are staying in the hospital for longer periods of time and they're not ambulating as much as they would when they are home. They're also placed post-operatively. All of this is done in order to prevent a blood clot from forming, either post-operatively or because they're not ambulating as much in the hospital setting. So it's important for them to get this in order to prevent clots. So now, we are going to look at the answer choices. The answer choices here show 1, when the patient is still laying in bed. 2, when the patient complains of having leg discomfort. 3, when the patient's feet becomes edematous. Or 4, after the patient gets out of the bed. So let's think, which test-taking strategy should we use with this question? We already know that anti-embolism stockings are placed in order to prevent a clot. They're usually placed when the patient is in the hospital for longer periods of time and they're not ambulating as much, and post-operatively after they've had surgery, because that is when a clot can form. So let's look at these choices. So from what I see here, when the patient is still laying in bed, and number 4, after the patient gets out of bed, those are opposites. So I'm going to look at those. Now let's look at number 2, when the patient complains of having leg discomfort. This to me sounds like a wrong choice because you want to put those anti-embolism stockings before that actually happens, because if they start expressing leg discomfort, has a clot already formed is what you should be worrying about at this point. Number 3, when the patient's feet become edematous. So one of the signs and symptoms of developing a deep vein thrombosis or a blood clot in your leg is that one of the legs, or if you have bilateral DVTs, they become edematous. Also, when there's not enough venous return coming from the lower extremities up to the heart for circulation. So I want to put these anti-embolism stockings before that happens. So I'm going to also eliminate response number 3. Now let's go back to our opposites. Number 1, when the patient is still laying in bed or after the patient gets out of bed. When should you put these stockings on? Well, when you're putting these stockings on post-operatively, usually the patient has not gotten up from bed yet. They're trying to recover from this surgery. Or let's take the patient that's not post-operative, that it's going to be laying in bed longer periods of time, not ambulating as much because they are sick and they're not home. So they're not getting as much activity. So you want those stockings to be placed before anything happens and definitely before the patient starts getting up. So the time frame of this is crucial in order to prevent further complications. So this is an opposite question and also a time frame question, right? So you're going to look at those opposite response choices that is evident here while they're still laying in bed or after. So which one is going to give the patient a better patient outcome? So the answer choice for this one would be while the patient's still laying in bed. And then we look at the post-operative part of the question. So when someone just got out of surgery, are they really walking around? No, they're not. So that is exactly the moment when those stockings need to be placed. Now let's look at question number 4. Nurse is caring for a patient with peripheral vascular disease. Upon assessing the patient states, "My feet and hands feel like pins and needles, and when touched, they hurt." Which of the following is the likely explanation for these symptoms? So I'm going to take my 20 seconds to critically think this question. So the question is asking me about peripheral vascular disease and what are the signs and symptoms that you would see. So what is peripheral vascular disease? So I know that this is a circulation problem that the patient has because the lower extremities are not getting enough oxygenation due to the peripheral vascular problem. They are not getting that oxygen that they need to survive. So a lot of times what you're going to see patients is complain of pain, discomfort. It's similar to the pain that you get when your foot falls asleep. So imagine having this feeling 24 hours a day, 7 days a week. So I know that patient is going to complain of pins and needles, and when you touch that patient's leg, they hurt and they jump like this. So let's see what those answer choices could be. So here are your answer choices for question number 4. 1. Inadequate tissue perfusion leading to damaged nerves. 2. Fluid overload that leads to tissue damage. 3. Patient being edematous in upper and lower extremities. 4. Psychiatric disturbances that is causing the patient to think he is in pain. So which of these answer choices do you think is the correct answer? We just talked about what peripheral vascular disease is and the signs and symptoms. So let's go over them now. 1. Inadequate tissue perfusion leading to damaged nerves. That sounds right because peripheral vascular disease is a perfusion problem that can eventually lead to damage in the nerves of the extremities because it's not receiving enough oxygen saturation. So let's keep that there. 2. Fluid overload that leads to tissue damage. Does this relate to peripheral vascular disease? No. And we have no indication that the patient is edematous. It's not showing this in the question. So we will eliminate that one. 3. Patient being edematous in upper and lower extremities. Is this something that is being told in the question? When looking at the question, it mentions nothing about edema. It's talking about peripheral vascular disease. 4. Psychiatric disturbances that is causing the patient to think he is in pain. So this answer sounds like a judgment. So you want to make sure you definitely eliminate those because 1, you don't assume, and 2, you cannot make a judgment as to the psychiatric mental status of this patient. So the one that actually matches peripheral vascular disease diagnosis is 1, inadequate tissue perfusion leading to damaged nerves. So if the periphery does not get enough oxygen saturation, enough blood flow, they will start to die, and eventually the patient's going to start expressing a lot of pain, like pins and needles, just like when your foot falls asleep. Actually, it also feels like when you hit that elbow and you say, oh, I hit the funny bone. But it's not a funny bone, it's actually a nerve that you've hit. So it's the same feeling that they feel, but they feel it all day, every day. Let's quickly review. Read all instructions and test questions carefully. You would not believe the amount of students that read questions so fast that they miss an important component of that question. And if they don't reread it, they won't catch it, and it will be a totally different answer than the correct answer. So make sure that you're reading the instructions and the test questions carefully and take your 20 seconds at least to critically think that question. Answer only what is being asked and stop reading into the question. Leave the storylines for after the test or before the test, but during the test, only answer what is being asked. Do not assume anything. Do not add on to the question, because in the NCLEX world or any type of examination, things are readily available unless otherwise noted. So they will let you know if something is missing. And remember to time yourself, because you don't want to take too long in a question and not have enough time for those other questions. Remember that in the NCLEX specifically, each question that you get builds on each other. So if you get a select all the apply, eventually you might not have enough time to answer that, because you've spent so much more time on others that are not as difficult as that one would be. So make sure you're timing yourself. Always cover your answers. Always take at least 20 seconds to analyze that question and read it carefully. So I hope you enjoyed this video presentation. Make sure to watch parts 1 and 2 of test taking strategies. And I really do want you to combine parts 1, 2, and 3 and start answering some questions in preparation for any exam that you have, especially if you're taking the NCLEX or the HESI or ATI, and any quizzes that you may have in this virtual learning environment that we currently are on because of the pandemic that's devastating to the entire world. So if you have any questions, any comments, feedback, make sure that you put it down below. And don't forget to like this video, subscribe, and hit that bell that is in the corner of your screen in order for you to get notifications as to any content videos that I put up into this YouTube channel, Dr. Registered Nurse. And share with all of your friends, especially those nursing students or any student that is going through exams at this moment. Remember that in order for you to prepare for certain exams, especially the NCLEX, you should be doing at least 25 to 50 questions a day. So I highly recommend that you get an app on your phone or your iPad, or if you want to use your computer, and just do them throughout the day. You don't have to do them all at once, but at least get 3,500 questions in before you take any of these board examinations. And also read those rationales. Look for the next part 4 test taking strategies, where I'm going to give you 3 more strategies to add on to the other parts, and I want you to use them and let me know if they work for you. I do read all of your comments and I respond to each and every one of them. So I look forward to all of the information you provide to me, and thank you again for all of your support. Have a great rest of your day. Bye.